Hi TrueCore, Coach Christy here with your monthly mobility. This month we're going to talk about pain and how movement can help prevent pain, how movement can be helpful for treating pain, and how through good movement patterns we can help prolong hopefully some chronic pain issues that could come up throughout our lifespan. So most of you know, because you spend a lot of time in the gym, that movement is absolutely essential for life. Movement helps get nutrition to our bones, our joints. It helps keep our muscles moving in the right direction. So the first principle I'm going to talk about is resting is resting. So the longer we stay stagnant, the longer we don't move, the more our joints are going to rust over time. So that's usually one of the first things I talk about with patients is you have to move to help improve your situation. So when we think about what we're doing in the gym, having good healthy movement patterns and doing movements in the right way is likely going to decrease your likelihood of having pain, one, with those movements, but two, with also functional things that you do in your daily life. If we take our spine model here, the spine is a little bit twisted, just to give you a heads up, but we think about all of these joints in our spine. If we don't move properly, so that's just staying still, nothing is pumping around that area and we're not really getting good nutrition to that joint. However, when we bend forward, we bend backwards, we rotate, we move, what that does is it creates kind of like a milking effect around the joints. So then the joint moves and that can help get nutrition to that area. Your muscles pump, so normally you would have a lot of muscles lying over top of your spine, around your spine. That muscle pump is extremely important for getting nutrition to your joint. And the muscle pull is also really helpful for creating good strength and helping to maintain good bone density over time. So that's just kind of one thing I want you to think about. Resting is resting, so we want to keep moving. The next thing I want to talk about is when you experience pain, movement is medicine. So we want to think about trying to find a way to move so that your body can heal from whatever that pain is that you're feeling. Pain can become a very psychological process, and it can become ingrained in your nervous system, where basically when you start experiencing pain, your brain gets a signal for that area to stop moving properly. The process is much more complicated than that, but we're just going to kind of say it works that way just to help with simplicity's sakes. So when you experience pain or an injury, we want to learn how to move well to hopefully help decrease that pain and to help in the long term make sure that pain doesn't return again. So the next one is movement is medicine. Finally, we want to talk about flushing it out. So a lot of people will get muscle soreness after workouts, especially after really long, intense workouts, or for example, this week after Fran. Fran is a very, very short workout, but you do a lot of work in that short amount of time. So when we're sore, oftentimes we think, oh, I don't want to move, I don't want to do another workout because I'm just going to get more sore. It's actually the opposite. So we want to think of exercises that can help flush those areas out. So sometimes that muscle soreness comes from a lot of lactic acid buildup in the muscle, things that really cause more issues. So good things to do when you're trying to do a flush workout, riding the bike at a nice steady pace, rowing at a nice steady pace. I like to use some of those days to do some more accessory work, so I'll do some of my banded exercises, doing some good mobility work, so thinking about your foam rolling, doing some great stretches. Yoga is really good to do when you're really sore. Another thing is drinking water is essential because it's going to help flush those areas out. So think about, you might be sore, but movement is actually exactly what you need to help get that soreness down. Even something as simple as taking a little walk. If you work at a desk, getting up from that desk every 20 minutes and just standing. It doesn't mean you have to take a huge break from your work, but standing, walking around your desk is going to help flush those muscles out again. So a couple things to think about. Resting is resting. If we stay moving, we are going to be healthier and we will likely have less pain as we age because your joints are going to have the proper nutrition, range of motion, and muscle extensibility around the joint to keep you moving in the right way. Second, movement is medicine. So if you have pain, if you have an injury, find somebody like myself or one of the other coaches to help you find the right movements to do so that you can still keep moving but not stop moving. Our body releases amazing chemicals when we exercise, so it can actually help take away some of that pain process and help reteach your body that it's okay to move. And lastly, flush it out. If you're sore, you're experiencing some of that what we call delayed onset muscle soreness after a big workout or a hard workout, move. Take a walk, ride the bike, do some banded accessory work. Just do something that's going to help keep your body moving. Doing a really heavy workout again might not be the right solution, but do something that's going to get your body to move and get multiple joints in your body to move. If you have any questions, please feel free to find me in the gym. Thanks.